Hi, everyone, and welcome to another edition of the Holistic Health Hub. And this week, we are down one of our partners. Unfortunately, Harry has something that he needs to do, something family related, and we are here to support him. But we are here, and we're going to go right to Sally. Introduce yourself.
Hey, Sally here, holistically fit specialist, and just returned from a lovely time in Sydney, and it's freezing in Melbourne.
And Shauna.
Hi there, I'm Shauna Drew. I'm a naturopathic doctor in Toronto in Canada, and with a big focus on women's health and hormones.
Perfect. And my name is Maggie Chilton. I am a registered holistic nutritionist. And I did actually see the pictures of where you were in Sydney or Manly, and it looked like Toronto right now.
Ooh, really, because great skies. It was very overcast and chilly, and today, of course, I'm back and it's 27 degrees and really warm and sunny, but it was very grey and yucky. So is that what it's like at the moment over there?
No, it's right now. It's sunny, but it just reminded me of, being in Toronto and that sort of weather. I'm like, oh, well, we're not in Australia, but it's okay. It's not hot and sunny there right now.
Same, but different, hey?
So our topic today, we're going to talk about taking action. So maybe, Shauna, you'd like to start off on your thoughts about taking action, either yourself or within your clinic.
Sure. So this is something I think about a lot because I work with, a lot of people on a weekly basis. And the common thing people come to see a doctor with is, a health problem that they want help with. And there's different ways of working with that. So I can be a health partner where I am helping them to take care of their own health, or I can be somebody who's telling them what to do. And the whole point of, what I try to switch in my working with patients is to be able to take action for their own health and take ownership for it. And, eventually we get to the discussion of not feeling like they're a victim of whatever their health struggles are, which is a really complicated place to be because sometimes the health struggles are real and significant and difficult. So how do we, take ownership for that, and ride the waves of, suffering and struggle that go with it. So curious what your takes are on it as well.
Mm-hmm. Well, I think first step is preventing the illnesses, putting things in action and in place so that we don't get down to that point of having the illness or having the disease. I mean, it's frightening, the statistics in Australia, and probably the same over where you are and around the world. Heart disease and cardiovascular issues and cardiac arrests and whatever. There are many deaths are actually preventable if people actually took some ownership of their own health at a much earlier stage. And from kids upwards, but particularly in your 40s and onwards, doing things to try and prevent illness down the track, from diet and exercise, just reducing bad stuff in their diet, doing some more exercise and owning it and saying, look, I don't want to be that person down the track. I'm saying I don't want to have heart disease. I don't want to have a cardiac arrest. I'm going to do something about my own health and own it and be responsible for it. I think that's where we really need to focus with people is saying, own your own health, be responsible for your own body and your own well-being. And I'm a really big advocate on that because, why have an average life now and down the track when you can have an awesome or exceptional one just because you can't be bothered owning your own stuff and being responsible for your own health and safety. So that's my little bit today.
Yeah, I think it's twofold. I think nowadays we live in an instant gratification society. So we're not necessarily concerned what's going to happen to us 6 months, a year, 2 years down the track. We want something now. And we can see that, I think, from, not necessarily the health and fitness, but maybe the diet industry. Everything's a quick fix, right? Yeah. So are we willing to put in the work? But the other thing is, even within my own modality, if you like to call it that, it's in our code of practice and our code of ethics that the client has to accept responsibility, those exact words, accept responsibility for their own health, that we are not responsible for that. And this was actually just on an exam that I wrote for my students. And I would say 90% of them got it right. But that's one thing that we're definitely missing in mainstream, in the mainstream health community, I think, is that they're not, as in MDs, etc., are not necessarily into preventative care. They're into what can I do to stop and fix it right now. And with us in the holistic field, we are definitely more the fact that how can we, you're right, Sally, how can we prevent what's going on? In order to prevent it, we have to accept responsibility for everything that we do, what we put in our mouths, the food that we buy, the movement that we have, body, mind, and spirit.
Yeah, totally.
Yeah, it's interesting. If you actually go into, like, so I get into the research as well, and this is something I talk about a lot, is that 80% of the prevention of most health issues, chronic health disease, and 80% of the treatment actually comes back to pretty simple basics. But the reality is we don't really do it. So it's eating relatively well most days. It's moving your body every day. It's managing your stress and getting enough sleep and not overdoing substances. So, you know, that's kind of like the big picture of prevention. So how do we, how do we sell that, right? It's not, it's something that is, people are often looking for the magic pill or the supplement or the diet that's going to get them there, when the reality is that it's just consistency of pretty basic self-care over time that's the biggest factor. So it's like, you know, living that boring moderation.
And it doesn't have to be boring. It can be fun. It's fun to be healthy. It's fun to eat well, you know, because you feel so much better. And it's just bridging, you know, getting over that first little hurdle of understanding it's actually, you're better off being healthy and fit because you feel better and it's more, you have more fun in life, more joy and happiness. Absolutely.
I think you hit on a very good point there, though. It's that it's like when somebody goes on a sugar cleanse or sugar detox, they have to get over those first, let's say, even 7 days. Those first 7 days are like the hardest. So for somebody to even change their day-to-day existence even slightly, for some people, it's just too much or it's really hard.
Really hard.
Obviously, in 3 to 6 months, they'll be like, "Ah, that's the best thing I ever did. I'm so glad I did it." But in the interim, hi, Glenn. He likes to pop in and say hi. But in the interim, you really have to, and I say have to, you learn to be present. But that's so difficult, even for us, I think in the holistic realm, it's still difficult. So imagine what it's like for the average Joe who is not used to being present and not used to actually being in the present moment and not thinking of the past and then the future and everything else.
There's overwhelmed, kind of stuck. Where do I start? You know, they need assistance, motivation to get across the bridge. But I think, I don't know, somehow hard-hitting facts, you know, I think it's every 13 minutes an Australian dies, I think, if it's heart disease. Every 27 minutes someone else dies of a, you know, another heart cardiovascular thing. You know, every 10, 15 minutes someone's dropping dead because of stuff that could have been prevented. You know, we need some hard-hitting facts, you know, some marketing around that, you know, the government or whatever, you know, to encourage people and help sort of reduce that fear and just go, it's okay, you know, we're all in the same boat and it's not easy, but we can go along it together. Years and years ago, back in the 80s, they had this program called, or this campaign called Life Be In It. And they had this guy called Norm, and he had the biggest, fattest gut, and he sat on the couch with a remote. It might have even been without a remote back in those days. But anyway, it was a huge campaign about get up. Let's not be a Norm sitting in the chair with a big fat gut, you know, drinking beer and eating crap, but like get outside. And it showed Norm being active. It was like little cartoon characters taking his kids for a walk. You know, he was struggling, but he was slowly finding it easier. And it's a bit like that, just, you know, because if you don't move it, you lose it. And that's on with every level of our minds, our bodies, whatever. But yeah, I don't know. It's a good thing. I mean, what can people start doing now? You know, just start thinking about themselves and where they're at, and, you know, what could they perhaps be doing better? Just tweaking little small things can have such enormous changes. It might be just start building up your water intake to 2 litres. You know, I know a lot of people don't drink enough water, and that's a very good starting step. And then the sleep and the stress, you know, they're huge things, aren't they? What are some recommendations, Shauna, that you would throw in there for sleep or...
Actually, the first place that I start with people is the perspective that they're making these changes from. Because if we just pile up a list of shoulds, then you're going to rebel against it. So it has to come from a genuine place of self-love. So like we talked about last week, you have to be doing it because you care about yourself and how you feel and where you're going with it. Otherwise, you know, it's like somebody telling you that you should do that and then you never do it. And we're the same with ourselves. So I think the first place is to cultivate that caring for yourself, that you actually want to take care of it first. Otherwise, it just won't stick. So that's where I usually start. Otherwise, yeah, I mean, I'm really good at giving the doctor advice, but that's not really, like, that's not the magic that gets people better. What really helps is when they, like we started with, they take ownership and they start wanting to get better, and they start changing how they live, and they start changing how they think about themselves. So I find that the more that I practice, the more I talk about that rather than the specifics of how to, because I think most people generally know what they should be doing. It's not, I don't find it's that much about education anymore. Maybe that's just the type of people who come to see me now, but there's less of that. It's more, how do we actually implement this?
Yeah, I think that might, potentially it might be your clientele because, you know, as an RHN, that's our primary role is of educator. Mm-hmm. That's what our primary role is and always has been. And, you know, even just educating people to drink more water, actually sleep, you know, get the phone out of the bedroom, those that we just take for granted. Yeah. Most people have no concept of how important that is and even why it's important. Well, why should I get rid of my phone? It's my alarm. Yeah. And then you sort of, you know, you have to then sort of explain your reasoning behind it, but they'll come up with 1,000 reasons why they should. So it depends maybe what your catalyst is. Why do you want to do this? Why is it important to you? And also, I think for a lot of people, they have to hit rock bottom. They have to get to that point where they know themselves that they have to change. You know, they sort of say to themselves, I cannot do this anymore. I need to change something. And I think that's when real ownership comes, is when they sort of feel that there is no going back. Like they can only go forward and they need to know how to go forward.
And often that's, you know, that's when they get an illness or something major happens, like a heart
Unfortunately,
attack.
Yes.
And that's like I was just saying before, a client's husband, age 50, he went into just a standard checkup and was put into hospital and had a quadruple bypass like the next day. Like a wake up call, hello. And that's my whole thing. I think people really just need a little holding hand to get started. And then it's always the first step, isn't it? The hardest thing, making the first step. And yeah, you're right, Shauna. It is absolutely about loving yourself enough to want to do that, loving your family enough to want to be there for them, and not providing, you know, higher risk of illness or whatever for your family. Like, you know, how many 40, 50-year-olds do you see are living walking heart attacks, ticking time bombs, ready to go off? You can pick them in the supermarket, in the mall, wherever. And you think, oh yeah, but and they've got kids with them. You know, oh, it makes me so sad. You know, I mean, and everything's, you know, a work in progress. Like, you know, you're mentioning the phone and it's like, oh, damn, yeah, I still have my phone next to the bed as the alarm. At least put it on airplane mode. I keep forgetting, you know, so everything is practice as well. You're going to fall off the wagon, but it's about getting on and not giving up, not sabotaging yourself with that head talk and whatever, and going, no, come on, encourage yourself. You can do it. It doesn't matter. You're only human, owning it, and just go, yeah, try again.
And you know what's funny, when people say to me, oh, you know, I need it as my alarm clock. I say, well, my phone isn't by my bed and I wake up in the morning. Look at that. Isn't it surprising? And they're just kind of like, oh, right. Yeah. You know, we did wake up before phones were invented. So it's, you know, it's getting back to you know, it doesn't have to be right beside you all the time. There's actually a really good,
I was just going to say, it used to be those damn alarm clocks that emit so much radiation. It's not funny. So we've gone from one to the other. I remember
there was a podcast I was listening to just a couple of days ago, and I can't remember his exact words, but it was all about, you know, we're no longer in a position where we focus on something so much that everything else doesn't exist. Like really, really focused, because we can be focusing on something, but we'll have our phone right next to us. So if it buzzes, oh, what's that? And then you go back to your task. And then, you know, oh, okay. And then, so we're so used to that. And it's the same when you go to bed and your phone's right beside your bed. It'll be vibrating, or it'll be doing something, or your mind will probably be thinking, I wonder what's happening. I wonder if somebody's messaged me. It's exactly the same thing. So again, if one of your things is you need to sleep better to X, Y, and Z, you need to be prepared to do whatever that takes. And if that takes getting rid of the phone out of your bedroom, that's what needs to happen. But if you don't feel it enough and you don't know why you need to do it, most people say, well, it's not important to me. I don't need to do that.
And it comes back to owning your own, being responsible and owning your own choices and actions. And, you know, it's a big thing to face yourself, really, and face your habits. And face that you're responsible for you. Nobody else is. We can't blame anybody else for our own choices. And that's not easy to do or understand straight up. I think that takes a little bit of time of, oh, holy shit, really? I'm not going to the doctor and they're going to cure me. I have to cure myself. And, you know, we can get right into all the deep levels of it.
Actually, something just came to mind then.
Yeah.
While you were talking, it made me think that maybe, potentially, there are more women that are in this situation where they don't necessarily want to take action or take responsibility, because they do that for everybody else. So their children and potentially their partners and aging parents, they're having to make decisions and take action and take responsibility for these people. So potentially, us as women kind of go, you know what, I'm done taking responsibility, taking action. It is what it is. Just a thought that I had.
Yeah, possibly. It's part of sort of treating yourself at the end of the day is like, I deserve a break now. I've been taking care of all these people until it catches up to you. Yeah.
And
they think, I wish I'd done that 10 years ago.
Yeah.
And then they come and see you, Shauna, with thyroid and adrenals.
All the time. Yeah. Yeah. I mean, I guess the other advice I have is that, you know, if you're thinking about how you would like to be taking care of yourself better, one thing that I often recommend is just looking at how do you like to plan ahead for the times where it's not going to work out. So how do you plan for the weeks that you don't have time to grocery shop because you traveled on the weekend? Or the weeks that you know you have to work late, how do you fit in your exercise? And how do you maintain good bedtime habits when the workload is high? And I think it's good to just put a bunch of thought into that in a discussion of, you know, where is your flexibility with your self-care plan? And how do you maintain consistency even when life goes crazy? Because otherwise you're just going, you know, you're on the wagon, you're off the wagon. And that on and off is actually, I think, it really wears us down.
Yeah. I mean, structure is so important, bringing in some regular routine with structure wherever you can. And as you say, you know, every day is different, but if you can somehow put in, it might be 6, get up at 6 and make that a dedicated thing. We talk about this all the time about making time for yourself and making time for things that are really important. And I think your health and well-being has to be at the top of the list, and we need to really, really feel that, not just say it, but really feel it for so many reasons, and then look at the reasons why, because we want to have a healthier and better quality future than just what could be in line for us if we don't start addressing some of these things now. I think we should sort of throw out a couple of action plans for the week that we could all start, you know, just being real, because, you know, we talk about it, but we may as well do it as well and feel it.
I agree. So why don't you set us off?
I'm going to start with the phone for starters, because that's something that I've fallen off the wagon with. I forgot all about it. So I'm going to stick to that one. And I'm going to write up a plan this week. Well, I already have one. But it's where I'm going to put my exercise in. And it's a no-go zone. That has to happen, you know. Like, I book clients around it. It's just 1 hour. in a day. And it's really important that I get that in. Well, I do 2 to 3, but that's just me. But, making it a definite that it's a no-go zone for anything else, it's really important that I put that in. And I really think that's important for so many people. Like we say, it might just be walking to clear the mind, do that bit of meditative space, get away from the kids, get away from work, or just let it out, shake your shit off. But having that space to do it, I think, walking gives you a double bonus. You're getting the mental, emotional, and the physical. So that's me. Exercise and phone.
What's yours, Shauna?
Mine's also exercise, because I use being too busy as an excuse all the time. And I get the walking thing in, but when I actually check in with, am I exercising enough for what I think is optimal for my age and my life, it's not there. So mine is to fit 3 workouts in no matter what, because life's always going to be busy, I think. And also getting to bed by 10:30. So that's a big one.
Yeah, that is a big one for you.
I usually do, but there are days where I want that break at the end of work, and it's hard to have the discipline to get yourself in bed.
Definitely don't take up Netflix. That's a big hint. Oh my Lord. I just watched the kids.
I will attest to that.
Yeah. And how about you, baby?
Oh, I think mine for this week will be being more present. So
Write that down.
What's that?
I'm writing it down, keeping you
okay, because I can, and I have been present, but I let that slip sometimes, and I let life take over. Whereas the last few days, I've really focused on, I have another one too, really focused on being present at certain points during the day. And the reason I said I have another one is because this week music has been my savior. So I've been playing music when nobody's in the house, playing music really loud, singing and dancing to it. And it really, really helped my mood. It really did. It was great. And I have to do that more often. I have to just blare out the music, because I listen to like modern country and stuff now. I know, but it's a favorite song. It's a Keith Urban and Carrie Underwood song. It's a favorite of mine.
That is the best song. That is
okay. And funnily enough, I was in a store the other day and it played, and I was like, okay, what's going on? But a particular song or particular songs that I just know the words to and love to sing and dance, and that's for me is amazing. So that's what I want to keep doing.
Yeah, music is so powerful. It's so powerful.
And I forget that because, I forget that I work in an office at home in dead silence every day. And I forget that because that's just what I do. And then as soon as I listen to music, I'm saying, why do I not take music breaks?
Yeah. Well, the music affects my clients. So we put on some really cool music when I'm training all the time, and it really pumps them up. Going, not Eye of the Tiger stuff, but it doesn't matter.
80s mix. I love the 80s mix. Oh my goodness, give me a Duran Duran and I'm good.
But my clients were born after that and they don't get it, but I know the words to everything. But it's funny, my teenagers now, 80s music is in. So I was at one of their parties and I knew all the words, hidden in the kitchen, but I knew all the words to all the songs that they were dancing to. But I think this is a really good point. We're just basically regrouping because everybody sort of gets a little bit derailed with life, and it's really good to sort of regroup and check in because we're all, we're into health and fitness and well-being, but, we get derailed too. So we're human.
Absolutely. Yeah. Okay, fantastic. Thank you so much, ladies, for joining me on the Holistic Health Club this week. It's been amazing. If you love this video, please make sure you like it and share it, or share it to anybody that you might think would find it relevant. That would be great. Give us a thumbs up on Facebook and subscribe to our channel, YouTube channel, so that everyone can find it. Okay, thank you so much. I'll see you ladies next week.
Okay.
See you later.
Bye.
Bye.